it's estimated that 1 in 4 individuals is actually experiencing a mental illness. That equates to around 25% of the general population. We also know that there are certain populations that are more at risk. It's currently estimated that up to 40% of people living with HIV also have a mental illness. Another high-risk group, females during pregnancy and in the postpartum period, their risk for developing a mental illness is also high. But what is also of a concern is the high rate of mental illness among children and the adolescent population. When we're looking at the differences between mental health and mental illness, mental health refers to the state of being where an individual is able to identify and recognize their capabilities. They're able to cope with normal stresses of life, and they are also able to function productively, whether it's at work or it's at school, or within their community, but also they are able to contribute to their community. When you look at mental illness, then obviously this individual is unable to achieve. They also having a disturbance, whether it's in their emotions, so someone who's feeling extremely sad, but also there can be a disturbance in their thought, and there can be a disturbance in their behavior. If you don't have good mental health, you won't be able to function, right? And the mind and the body actually work together. So if physically you are well and you're not well mentally, you still won't be able to function well in your community. And your mental health also contributes to your physical health. So the mind and the body, I think it's very important to remember that the mind and the body work together, and it's very important to then prioritize your mental health as much as you prioritize your physical health.